This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what the risks are of steroid injections. If you like this video, we put out new content weekly, so please like and subscribe. So risks of steroid injections. Just to be clear, I'm talking about corticosteroid injections. Corticosteroid injections are anti-inflammatories. They will not help you build any muscle. You're not going to get jacked from them. They're just anti-inflammatories. Compare that to anabolic steroids, which are the muscle building type, corticosteroids, the anti-inflammatory type. So what are the risks of these injections? So these are the common risks. This is just essentially, I give a lot of these, and this is sort of what I say before I give them. So there's always a risk of infection. You can get that from any injection or any time you break through the skin. It should be pretty rare, assuming that the doc is not using expired meds and not using single dose vials multiple times. The vials basically come in single dose and multiple dose. They look the exact same. The difference is the multiple dose vials have like an antibacterial in them, and the single use don't. So once you pop the single use it once. Even if there's fluid left in there, you gotta throw it away. If it's the multi-use, you can use it for a while. Anyways, so there's infection. If it injects like a ton under the skin, it can sort of, if you inject too much into the fat, now we're not normally injecting into the fat, but some might get into the fat anyways, it can thin the fat. If you're darker skinned, it can also depigment the skin. If you're diabetic, it will raise your blood sugars. This is temporary, but if you're a brittle diabetic and your blood sugars shoot way up, you got to be careful because it will jack your blood sugars up temporarily, depending on how your diabetes is. There's also some sorts of, if you inject a tendon too many times, you can get a rupture. I've never actually seen this or known anyone who's seen it. It's basically a few tendons like the patellar tendon, the Achilles tendon, and if you inject them with, most people won't even inject them once, but if you inject them over and over and over and over again, you can get a rupture. The best literature I saw on patellar tendon ruptures after steroid injections was in, I think it was Taiwanese weightlifters, and they got like an average of like 5 or 6 patellar tendon injections over the course of a year so they could weightlift, and a good chunk of them had ruptures. The other risk, there's a bunch of stranger, sort of less common things. Obviously, you can get facial flushing where someone's face turns red. I've seen that. And hiccups, strangely enough. That's mostly supposed to be with spinal injections. I've seen it one time where someone basically gets hiccups and they won't go away. There's also something called a flare reaction. So when you inject a steroid, it looks like a liquid, but if you look really tiny down, it'd actually be little crystals. And sometimes someone's body can kind of attack that, and they'll get like extra inflammation. So it'll be like a steroid flare, they call that. Usually resolves in a week or so. But sometimes you inject someone and then they're in extra pain for a while. But otherwise, assuming someone's using pretty sterile technique and using the appropriate doses of steroids, it's a pretty safe thing to do. Of course, you can always hit other structures like blood vessels and nerves and things like that. Especially if you're doing like a carpal tunnel injection, you got to be careful about that. But those are primarily the risks from steroid injections. Really, with any medical treatment you're going to have, there's going to be risks, from any medication to any surgery or injection. But those are the most common ones. For most people, they don't have anything that happens to them. They just have a little bit of pain, and then sometimes you'll get a flare reaction or, a little bit of facial flushing. So I hope I was able to answer your questions about the side effects of steroid injections. If you like this video, we put out new content weekly, so like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below. I'll do my best to respond, but I can't give you any specific medical advice about your condition because this video and all my videos are for educational purposes only.